I'm going to turn things over to Deanna Benner, who is with Christiana Care. And I don't know if you want me to read your whole bio, Deanna, but hopefully everyone has
Yeah,
seen it.
yeah,
And
beautiful.
we've worked together, been talking off and on for the last couple years or so, just about reducing plastics and encouraging sustainability. And Deanna's been telling me about all the things that are going on within Christiana Care. So I'm excited to learn more about it along with all of you. And we'll save Q&A for the end. So Deanna, I'll turn
Great.
things over
Well,
to you.
oh, thank you. Well, I'm very grateful to be here today to really talk about this important topic of how our health is intrinsically linked to the way we interact with our environment. And I really hope that I can inspire you to help make health the heart of climate action so we can together ensure the future of our stable, livable planet for all people. And these are my objectives. I want to just discuss how healthcare contributes to the greenhouse gas emission problems and how really health professionals can play this pivotal role in helping to mitigate greenhouse gases, global greenhouse gas mitigation, and how we need to make health the heart of climate action to protect human and planetary health. And I always just like to say like how I got started. And Dee knows my daughter Anna because she was involved in the Yes conference. And Anna is the reason why I'm here. She had severe and does have severe eco anxiety. She sees the world as it really is. Like these young adults, they see the problem, they can feel the warming, and they know that warming is a human issue and that we need to get our act together and reduce emissions. And they carry the anxiety because they just don't see the work that needs to be done to reduce emissions to make our planet stable and livable for all people. So they really carry the burden on their shoulders of doing this alone. So I vowed to Anna to help her with ego anxiety that I was going to model to her that adults really are trying to fix this issue right now. So once I made this pledge to Anna, I really had to learn about environmentalism. And I was so surprised how the healthcare industry that I've been in the last 25 years, how we contribute so large to the problem, but yet how we can really be the solution as well. Because health professionals, we really are the most trusted voices that can communicate to the public that this is a health issue and that climate change is affecting our health. And we really need to have global greenhouse gas mitigation and adjust to the changes that are already happening to our environment. So once I learned this, I started making presentations similar to the one I'm going to present to you today. And I thought if I just got in front of healthcare leadership, we would just change the way that we would do things, that everybody would have their like aha moment that I had when I learned about this. So I got in front of as many people as I could to share this information. And I work for Christiana Care, and people really did welcome me into their offices for me to share my presentation. I even got up to our chief financial officer, and this was way back during COVID, during Zoom, and he was so excited to share back the work that was already being done top down by creation of an ESG governance model to really have the leadership structure to address this issue going forward. So I went back to work and then I just realized I just wasn't seeing the change that I would expect mainly because, as you can imagine, hospitals have so many different priorities, especially coming out from COVID, especially staff burnout, financial stress. And I realized why it wasn't a priority is because it wasn't a priority of all the caregivers. I was like one of our 13,000 employees talking about this issue, but really there was just this paralyzation among health professionals. Like health professionals are educated. They really know that climate change is real, it's human caused, and that we really can do stuff now. But I wasn't seeing the work when I was trying to talk about it and engage my closest caregivers that work in my space. It's like, oh, Deanna's going off about climate change again. So I really started to understand why there is this climate paralyzation among health professionals. And I realized it's because, the national election that just passed, it was the 21st concern. And, of course, the healthcare community is just made up all above the people that work live in the community, work in the community. So it wasn't a priority. And then I also think when I started to learn about it is that there is a lack of knowledge about how it affects health. And then one of the bigger things is that people just think that the climate change problem is so big that their individual contribution to mitigating gases is really not going to change anything. So I set out to kind of, with this game plan of like how to address that. So the presentation today I'm giving you is the presentation that I give caregivers, but I'm giving you my game plan snuck in, and this is it right here to tell you what I'm doing with my presentation. So there's Alan and I at a conference that we arranged around Earth Day to educate caregivers. So any group I can get in front of, I want to educate how climate and health are connected. And then at the same time, I've been doing sustainability initiatives here at the hospital to model to people what one person can do, and then just continuing to grow our team of who's helping. In that picture in the center is Ashley. Ashley is an amazing OR nurse who's been helping me. So I weave in my story what I started and how the team is growing and the changes that we're making so that I can help people understand that they can make a difference. And then the next thing I do is all the initiatives. I try to prove the financial worth so that I can engage leadership further in these initiatives, saying like, hey, like going green really saves green. So by this continual story of education and modeling, I'm really trying to engage caregivers so that we can make health the heart of climate action. So then we can share this information with the public and get the local legislation that we need for clean energy, and hopefully continuing to spread that, past our state into other states too. But it really has to start with caregiver engagement. So this is my presentation that I give, and anytime I schedule a meeting, I come up with a presentation and I kind of tailor it to them. So when I spoke to hospital leadership, I talked about, what's the cost savings. And then I would go speak to infection prevention and give them the connection of like climate and health. This is how they're connected. And this is how infection prevention is connected to this, and how we can be sustainable from the infection prevention lens. So any group I can get in front of, I bring my slides and I really talk about how they're individual parts, so that all the parts together, we can have great change. So now I'm going to jump into the education part of what I would bring in. So everybody on this call, of course, knows that every time we turn on the news, there's a new environmental disaster going on, from our record droughts to our fires to our extreme storms, and all of it's related to this trend of heating. And we've been measuring temperature for the last 160 years, and there's this definite trend. 2023 was the hottest warm year on record. 2024 is set to break that already. And that is what I always like to say. People know that, but yet it still doesn't cause them for action. So this slide is like a patient's vital signs. Like people come in to tell us of a fever, and in the emergency department, we kind of don't really believe it until we take their temperature. And I feel like this slide really points to people that like, no, climate disasters, they're really happening, and they are so costly. They're getting bigger and more expensive. So these are what these two graphs. The slide on the right talks about just the billion-dollar weather disasters, how we set a record in 2023, and we hit that record in September. And when I looked at that information, what stood out for me about the most expensive disaster that the United States had was this drought. And this was a drought that affected the southern and midwestern states. And it was so expensive because of the loss of agriculture, and then the loss of cattle, because ranchers had to sell off their cattle because they couldn't afford to feed them. So I always think we don't really think about droughts. So that's why I put this into this lecture. And droughts are not only what the US experiences. And actually, the Lancet noted that 47% of all global land was affected by extreme drought in 2022. And the United Nations estimates that 1.84 billion people, which is almost a quarter of humanity, is living under drought-like conditions. And the United Nations Executive Secretary, he says, unlike other disasters that attract the media attention and then the resources, Droughts often operate in silence, they go unnoticed, and with that, they don't provoke that immediate public attention and public response that bring about the resources. And why droughts affect all people, it has a disproportionate impact on our most vulnerable and our poorest communities. And then droughts also are a climate change threat multiplier. And that's because they cause a decrease in crop production. And without a consistent source of food or income, this contributes to poverty, crime, and political instability, leading to global migration. And global migration leads to strife and civil conflict. Latin America, South Asia, and Sub-Saharan Africa are the areas most affected. And this is something that I think we don't talk about enough. And when I think of climate change, I think this is the scariest thing because this is going to lead to global chaos and really threaten the future of just global safety throughout the world for our kids' future. And it's estimated between 200 million people to 1 billion people will be global migrants by 2050, leading to just world instability. And with that, this is something that we can prevent by just getting that global greenhouse gas reductions and to keep that planetary heating closer to, looks like we're not gonna make the 1.5 to the 2%. And the drought conditions, as we also know, cause wildfires. And our wildfire seasons are incredibly more powerful and longer. And why I bring this up is that the wildfire smoke was the first time really where our region experienced the effects of climate change. Up until last year, we were pretty isolated from the effects of climate change. And it's so hard for people to really engage and make a difference if they can't really experience or understand it, that this is happening now. It seems so distant. But really, the smoke that we all felt, smelled, and breathed in should really cause alarm and cause us all for action. And just really quick, that wildfire smoke, we breathe it in, it gets into our bloodstreams, it causes inflammation, which then causes asthma, heart attacks, strokes, dementia, cancers, premature births, and premature death. And this picture here in the slide is my son. And during the wildfires, I really tried to protect him being a health professional from going outside, but he still had a severe asthma attack. And I just think about the wildfires, but there's going to be more to come in the future. And as a parent, to not be able to let your child, especially an adolescent child, outside because the air is a threat to him, like sending our kids out in nature is what helps them with depression, and to not be able to have clean air, it to me is a scary thing as a parent. But in addition to poor air quality, our climate change is affecting health and causing illness and premature death from the excessive heat, the infectious disease, water contamination, and so much more. So that was a bad news. The good news is really there still is time to mitigate the effects of climate change going forward. But we really need to act now. So the scientists on this slide here on the left, it shows the different heating based on how quickly we reduce our emissions. And unfortunately, many countries that pledge reductions, under the Paris Agreement in 2015 really didn't take the necessary steps because of climate disinformation campaigns. And in addition, scientists really got it wrong, and we're seeing faster warming than we ever did before. So as a result, it's really a now or never time to limit global warming. And we're really at a crossroads, and we all need to take action to make a secure and livable planet for all people. Let me go to my next slide. My next slide, I hope this plays. Can you guys tell me if you can't hear it?
I don't hear anything.
We can't hear it, Deanna. I don't know if there's
You
anything
can't hear it?
Yeah.
Hmm. Shoot, it's a really, really great movie. Hmm, I don't know how to, okay, how to fix that through Zoom. So maybe we could just send the link. Dee, I'll send you the link to it because it is a beautiful, like 2-minute movie that really, it inspires people to act.
Sure.
So I will send that out. Sorry, on Zoom, I feel like if I mess around, I'm going to lose my presentation. Okay. So going forward, that movie is really a direct call for all health professionals to be climate leaders. And we say, why do health professionals need to be climate leaders? And there's 3 reasons for that. So first, climate change has really been identified as the #1 public health risk right now that humans are facing. The second reason is we contribute, the healthcare industry, greatly to climate change, and that climate change affects health adversely. And the last reason is we really need everyone's help to save our planet. And with our polarized political system, people really don't trust our political leaders with communicating this message. However, as health professionals, we really have the unique opportunity to be that trusted voice to support global efforts to reduce emissions and to protect people from the threat of climate change. And this is because health professionals have been voted nurses for the last 22 years as the most trusted professionals. And right behind nurses are doctors. So we should be the one communicating that climate change is affecting health and that we need to protect health by with mitigation. And we also have the political leverage to do this as well, because the fact that healthcare is almost 20% of our GDP gives us this leverage. In addition, we spend a lot on healthcare, but despite this, we have the lowest life expectancy among our large wealthy countries. So we outspend them, but we don't have the health outcomes. And so this means there is opportunity to reduce low value care without compromising on quality care. So there's room to change the way we deliver care. So we spend a lot of money on our care. We also can contribute greatly to climate change with this care. And the healthcare industry, you guys probably all know this, we are responsible for contributing 8.5 of our total US emissions. And we also make a lot of waste. And together, these emissions and the waste is known as healthcare pollution. Healthcare pollution affects health, it exacerbates health disparities, and it causes premature deaths. And it's now estimated that the deaths related to healthcare pollution is on the same magnitude of deaths from preventable medical errors, which is the reason why we do so much in healthcare. Our actions is for those preventing of medical errors. And it's really going against our first do no harm principle. And we need to think about how we're delivering care. And this is the amount of waste. So hospitals in the US produce approximately 5.9 million tons of waste. It's a large number. What is a ton? So if you can just think of 5.9 Mitsubishi Mirages either going to our landfills, our oceans, or being burned, it is a lot of waste that can be reduced. And since it's a plastic-free Delaware, about 25% of this waste is estimated to be plastic. So this waste needs to go somewhere. So I investigated where the waste at my healthcare facility goes to. And it goes to our local landfill off of 495, our Cherry Island landfill. And I find it so interesting that, some of our poorest communities, of course, surround there. And these are our areas that, unfortunately, these people tend to have more chronic medical problems. And these are the areas that the healthcare systems in Delaware are trying to reduce the disparities. So thinking about where we send and reducing what we send is so important for the health of these communities. In addition, those who are in Delaware know that this waste landfill is always advocating to increase the vertical limit because it's threatened to be closed. So I take this information, and when going back to my game plan here, and I present this to leadership, they really respond to knowing they didn't know where the waste goes. And this is why we have to be mindful and reduce what we're sending to our landfill. So understanding more about plastics and disposables in healthcare system, our infection prevention really has driven this disposable movement, thinking that if you can throw something away, then you're less likely to cause an infection. So back to that preventable medical infections. And this is really what drives. And this picture on the left over here says that, you know, we've made such great progress over the last 100 years in preventing infection, you know, first with hand washing and then with antibiotics. There's a thought that we might never get to zero infections, but we keep just throwing more and more plastic at it, trying to prevent infections. And we know that, you know, acquisition of infection is really multifactorial, from whether the staff washes their hands really well to the strength of the invading organism, or how sick the patient is to start with. And out of all of this, the most important things are this proper hand washing and the host susceptibilities, how sick the patients are. And no matter how much plastic we throw at preventing infection, it's not going to cure the issue. And so we really need to think about how we're delivering care and not just jumping to plastics to prevent infection. And a lot of this is driven by Joint Commission. And for those of you that aren't familiar in health systems, Joint Commission is this independent nonprofit organization that evaluates and accreditates healthcare organizations and programs in the United States. So they come and they do surveys and they tell whether your hospital system is delivering safe care. So something that started out so great in making sure that healthcare is safe has really driven disposabilities and a lot of silliness to like do things a certain way to prevent infection. And so we jump through a lot of hoops to get this accreditation. And sometimes it's not the right, like it really drives more ways. So because of that, Joint Commissions, they're recognizing that they are part of the problem. So they've come up with certification that hospitals can voluntarily do to show how they're being sustainable. So they're trying to change their behavior. This is totally a voluntary thing, and that, you know, of course, there's more work for hospital systems to do, but it's at least a start that these inspections are just contributing to the problem because people want to do good. They want their hospitals to pass. So sometimes people really, they take certain actions to thinking that they are reducing infection when really they're just inducing more waste. And we really have to be mindful of this because if you guys know this, being a plastic-free Delaware, that if we don't change our ways, we're going to have more plastic in the ocean than fish in 2050. And then these are just a picture of some of the plastic that we see in hospitals. So there's plastic and then there's plastic more wrapped in plastic, thinking that things will get dirt and germs on them. This is a blue wrap here that just recently comes wrapped in more plastic, and the blue wrap was the sterile wrap to keep those instruments in there nice and sterile and clean. And we just need to think about all this extra plastic and change our ways. So now I want to shift to the environmental work being done at Christiana Care to reduce the footprint. And we're really lucky here. We do have executive-led leadership that is trying to reduce our environmental footprint. We have an executive-led Sustainability Governance Council, and with that, we have a caregiver committee, which is what I started. And then we have Eco Champions, so that takes it down to the role of the individual caregiver, that anybody can be an Eco Champion. And then at the same time, we signed the White House HHS pledge, which is so great. In case you guys aren't familiar with it, this was a pledge that was made by the current presidential administration to try and get healthcare to reduce emissions. And about 15% of hospitals joined. And so in Delaware, Christiana Care was one of them, that we will reduce our emissions by 50% by 2030 to go net zero by 2050. This most likely will probably be revoked with the new presidential administration, which is why it's so important as well that we have caregiver engagement on this issue so we can continue to have the mitigation that we need, even if it's not going to be top down from the government anymore, so that health systems all over this country can still drive the change that we need to make the planet secure and livable for all people. So these are really lofty goals to reduce our emissions. So with that, we have built into our annual operating plan goals that help us address the reducing of the emissions. But however, what I tell when I do these presentations to all our caregivers that, effective carbon reduction, it really requires everybody's participation and not just the top-down plans. And the belief that others will solve our environmental problems lead to dangerous inaction. So in the following slides, I'm going to model to you the change that I've been able to drive from the ground up as we wait for the larger, more meaningful efforts from the top down. And here I always tell the caregivers that I'm just a nurse practitioner, I'm a mom, and I may change. And however, most people really have greater potential for driving change than me. And then everybody with their expertise, education, influence can have impact that is truly transformative to ensure the thriving planet for future generations. So this is the part in my game plan about modeling the change. So when I did my presentations, when they were creating the governance plan, I was so fortunate that they asked me to lead the caregiver part of the governance plan. So I kind of ran with that, and I created this SharePoint site, which is really just for our hospital systems. It's an internal site that just has a lot of information so that people can know what is environmental sustainability, what's going on in the state, what's going on in the hospital, how they can engage. So first, continuing to educate our caregivers. Once I was in charge of the committee, I started to ask people what they were concerned about. And our caregivers really were so unhappy about styrofoam cups. So I set out to make a difference with this, and how I was able to get the health system to agree to change paper cups was really individual meetings with supply, where I got to tell people my slides. I brought my slides, and those slides were tailored to the planetary and the human health risks from styrofoam, and really talking about how we need to change. And it's so great when we've had one of our final last meetings, the supply people are like, we need to do this just for health. And so we are right now in the process of changing from styrofoam to paper cups. So, one person just educating really did make a difference on this issue, which would be huge because we have a lot of patients, a lot of paper cups, a lot of styrofoam cups. Caregivers also really cared about recycling. So I researched what we could recycle from the hospital and that we weren't recycling by going to the HPRC, the Hospital Plastic Recycling Council, and they have all this great information on their website. So I learned what we could recycle. And then I set out with my co-chair of my committee, Greg O'Neill, and we toured the recycling facility. And this was so great. Everybody, I've always wanted to tour a recycling facility. I wanted to know how they did it. So these were our containers. We went to the recycling, then they get delivered to the recycling facility, they get pushed in, and they go up on conveyor belts, and like items are sorted into like items. But what we found out is that all of our recycling material was being sent to the landfill. This is a landfill pile, simply because it was going in bags, but nobody ever told us that. So we changed the process. We came back and we created a new recycling process. And because of the information that Greg and I learned, and Greg's another advanced practice nurse, the hospital changed their vendor. It was a contributing factor. They were always already looking at how we can do waste better, but they included us in the decision making, and they secured a waste management partner now that is sustainable. So it's really great. But through this recycling process, it made me think about what's better than recycling, because I saw the trucks that had the recycling material leaving the facility, and I said, hey, where are they going? And the person who works at the facility said, oh, they're going overseas somewhere. So it made me realize that recycling is not the best option. So then I came back and I said, what can we do differently? Well, let's send less things to recycling, less to the landfill. Let's reconnect with, we had used Project Cure years ago, but the relationship had fallen to the wayside. And I called them up and I started our medical supply donation program for you. For those of you that aren't familiar with Project Cure, it is a nonprofit out of West Grove, PA, and they globally distribute medical supplies to resource needy areas throughout the world. So we started this program in February of this year, and we're so excited that we've donated over $73,000 worth of items. So I take that number and I give back to leadership and saying, not only did we not throw this in the trash, but now we can use that as our non-tax status. And so we're doing good and sending overseas. But when we went to Project Cure, we realized that they couldn't collect our expired items anymore because they couldn't get through customs. So they were throwing them away at the Project Cure facility. So I thought, what can we do that's better than that? So I contacted nursing schools and VOTEC schools in the area, and I learned that they could take our expired supplies. So we sort our items before we give them to Project Cure, and we give all of our expired items to these local programs so that we can help decrease the cost of educating the next generation of health professionals. And our schools love them. So it's been such a great program. And in addition, one of the other things by looking at our waste, most nurses, when they come across something that's expired, they would just throw it in the trash. But we learned that we had close to $500,000 worth of expired supplies from the operating room. Why this is so important is then we can then report that back to the leadership in the operating room so they can reduce and match supply and demand. So we're really reducing emissions that way by just ordering the right items. This is really having the biggest environmental impact. And communicating this number to leadership is so great because then they can really see the value of these programs and the value of reducing waste. With this, I learned that there's this trailer in the back of the hospital. It was called the recycling trailer, and everybody thought that everything was being recycled on. But we learned that everything was going to the landfill, but it was just taking a longer way through the recycling facility. So then I started this landfill diversion project. So now there's 3 of us, and we regularly go on this trailer and we try to get off things that are usable. So that's where I spent my morning. And we collect items that still have value that the community can use. And we, every 2 weeks, Habitat for Humanity comes and picks them up. So we're really helping the community as well. We weigh these items and then communicate back to leadership the costs that we're saving by not disposing of them. We probably could also itemize these as well for further value. I organized an eco conference this year. That was the one in the picture in the beginning with Ellen and I. This was just really to continue to spread awareness of health and the way we interact with the environment are connected to engage the healthcare professionals so that we can continue to turn up the volume of climate here at the hospital so we can have further engagement from top down and just really move this important message about making health the heart of climate action. Another thing I did was we had in my own workspace, I work in OB/GYN emergency, we had these packs that they really have a lot of stuff in them that we weren't using them. So I audited what we were using and then I took out the stuff that we don't need regularly. And by doing that, we're reducing the resources, the cotton and all the things that are going to waste that are in landfill, but we're preventing them from ever being needed. And then I put a price tag on it. I figured out how much each item was worth. And then I communicated that back to leadership by really looking at our packs. You can save just $12,000 per year in this one pack alone. The hospital has hundreds of packs like this. It's just taking the time to see what we need. This is the role of the Eco Champion that I created. This is just a self-designated role and it works underneath my caregiver committee that I run with Greg O'Neill. And so Eco Champions is the self-designated role for individuals who want to play a role in improving sustainability in their workplace. So they help carry out our sustainability initiatives, but it's also a two-way street, and they help us identify different other sustainable initiatives that we should participate in. So right now we're about like 1% of our employees, and I really hope that that will grow. Another simple project is just reducing the number of trash cans. This is an easy thing to do. Trash cans just seem to compile, and when they're together like this, our EVS teams have to empty it. And so that's a lot of plastic waste, because when they empty them per shift, they're probably just 10 to 20% filled. So went through our exam rooms, I took out a trash can, and then all these duplicate trash cans, they were all reduced. And especially in an office space, each desk might have a trash can, but there's no reason why that you need to have a trash can under your desk. You know, at home, you can walk 4 feet to throw something away. So taking trash cans away is an easy way to reduce plastic waste. Another thing that I did was, somebody thought it was a great idea to change from reusable to disposable pillows, and that it would be cheaper and easier on the staff, but they never really looked at all of the plastic waste. So 2 pillows came in all this plastic. And in addition, they would vacuum seal the pillows. So they were so flat that a laboring patient would have 6 of these on her bed. So if you can imagine 24 bags like this, is a lot of waste. So by advocating to leadership, I was able to change back to reusable pillows. So I weave that in my story of like, hey, this is something that we can do that has great change. I also helped advocate to joining Practice Green Health for the hospital. And this is a healthcare sustainability organization that helps hospital systems achieve their goals, their sustainability goals. It's so great. And the hospital really responded well, and it's been a great partnership. Another simple thing that I did was just reestablished our food donation program from the cafeteria. So I basically went into the cafeteria and I said, hey, where's our food waste go? And they said, well, it doesn't go to anybody. And so then I called up Sunday Breakfast Mission. And I said, you guys want our food? And I arranged for pickup. And then I arranged for the hospital buying them containers to be able to transport the food. And that was an easy thing to do, but an important thing to help our community and reduce waste further. I presented to leadership in nutrition about how important sustainable food practices are, since food is responsible for 10% of a hospital's overall waste. And then with the talk about how plant-based food is really the best option that hospitals should be serving. And the nutrition team, they have a new food contract, and they've done such amazing things. I think right now we're at 35% of all of our food choices are plant-based, but they are looking to increase that and to have the main meal be plant-based and to opt into meat. And I would be amiss if I did not say that was all these things that I'm talking about. I was running with them, but I kept communicating them to the leadership team at Christiana Care, and they fully supported everything I was doing. So the key to driving these sustainability initiatives at a health system is really involving leadership and communicating. And I have to give special thanks to Bettina, Rob, Jackie, and Angel for supporting all of this. And it's not hard for health systems to get behind green initiatives. So if you want to do it in your own health system, you just really need to communicate to leadership that, you know, going green, it increases staff morale, engagement, and retention, because staff care about this. It improves patient experiences. It improves our patient outcomes, because usually you're reducing that low value care. And it also decreases the cost of care delivery. So by communicating all of this, it helps with the support, but you really do need the top-down support with these initiatives that started. They grew from the bottom up, but they were definitely supported from the top down as well. And that goes because like 4 in 5 clinicians really believe it's important for their hospitals to address climate change, which is important again to tell leadership. And also by 2025, 75% of the global workforce will be millennials, and more than 50% of them will research a company's environmental impact and policies before accepting a job offer. And that's from Practice Green Health. So such important concepts to communicate to leadership. Okay, so what's real quick, what's going to be next for our healthcare organization? Ways that we can go further on reducing emissions is increasing the number of telehealth visits. There's a plan to transition to a full electric fleet. We're going to be adjusting supply, ordering to match demand because of our findings, constantly increasing participation in environmental research. So I talked to the residents saying, like, when you're thinking of a research project, like what can be an environmental focus or an impact of your work as well. Continuing to increase the plant-based offerings. We are right now transitioning to all LED lighting. That is the facilities department working on that. We're creating green teams in the pharmacy, in the OR, and the emergency department, like our 3 critical areas where there are low-hanging fruit for reducing waste. And then we are conducting at the end of the year our greenhouse gas inventory. So moving on, for how all of you can help make health the heart of climate action, I think it's really important that everybody learns more about climate change and health, and all of the resources on this page. They have such valuable information on how climate and health are connected. You can join the Mid-Atlantic Alliance for Climate and Health. Alan started that. It's a great way to really all of us work together on this issue and to just drive more change of all the health systems coming together and all our community players that are involved in this issue as well. So I helped create this website for Alan. So it's climate4health.org, and we can send that out with G12 email with the little movie. And so once you have a basic understanding of how health and climate are connected, it's really important to communicate the problem. And we need to, every time we have an opportunity, really seize the moment to discuss it, how we can improve health. And, through healthcare meetings, public forums, and policy discussions, we can really promote proactive environmental stewardship, and our influential voices really have the power to protect both the planet and public health. And every time we don't talk about it when we should, we're just like the golfer in this picture, oblivious to the fate that is upon us, because a health-centered response to climate change is really the biggest global health opportunity of the century. And if we make health the heart of climate action, our ability to inspire other sectors going beyond healthcare can be widespread, and their organizations could then adopt sustainable practice, and that would significantly contribute to global carbon reduction goals. And in closing, I just want you to take a moment to reflect of who do you want to leave a stable, livable planet to? And that is my children. This is 3 out of the 4 of them. And when my time on this planet ends, I want them to know that I did everything in my power to protect their future. And if we fail to take immediate and decisive action to curb greenhouse gases, their future is going to look a lot different than ours. It's going to be a continually increasing, uninhabitable, and chaotic world. But we really have the power right now to change that for them. And this is the future that I want to leave for them. I want beaches that still exist. I want unpolluted oceans with thriving sea life, with biodiversity, and flourishing forests that are naturally balancing the carbon dioxide in our atmosphere. And it really is possible. And green climate solutions can create jobs. They can expand our economy. They can clean the air. They can beautify our communities. And most importantly, they can improve our health. So in the end, I inspire you to, I wish that you can be the change that you wish to see in this world. And that's all I have. So I have time for questions. Right, Dee?
Wow, Deanna, that's all I can say. That you just blew us away. That's incredible what you've done there at Christiana Care and in the health system. And I hope, I don't know if you're kind of an outlier or if hospitals all around the globe, are doing some or all of this, and or at least seems to me like you're a model for all of them.
I think it can be done. I'm not anything special. I just am like one mom who is concerned about the future. And I think My daughter sees the world as it really is. I think the rest of us put beer goggles on, like, oh, life is fine. Like 80-degree weather in November is so grand. But just
Mm,
think back 5 years ago, and like this is so different. Our climate is changing so quickly that we all need to act.
yeah, but it's fabulous that your presentation connects the dots so clearly. It's really awesome. So thank you for being with us here today. And to those of you maybe who arrived late, I just want to apologize. My video is not working. So I am here obviously, but not visible to you all. So if there are any other questions, I'm sure there probably are. If you want to raise your hand, or we can just try to have folks unmute and ask questions.
I can't see the chat, Dee. So
Um,
if there's anything that pop up in the chat, you can just read them.
there are no questions in the chat,
Okay.
at least not yet. Anybody out there? Elisa, you have a question?
Sure. Hi, Deanna. That is just amazing. I mean, I know you're being very humble, but that's a lot for one person to do. And just thank you for doing that and for continuing to do it. I was curious, are healthcare providers starting to think about talking to their patients about what they can do in their lives that not only could help with the effects of climate change, but also with their health? Or do you see that as like something that could grow?
I think it needs to be done. I feel like that's phase 2. I haven't really gotten to the point of like creating the education yet that needs to be done. It's more like I just see such apathy that nothing was happening. So just trying to get them to like, it's okay to have conversations about climate. You're not politicizing by having them.
Mm.
And we need to get there. We're not there yet, but it needs to get there. Most of the time they say they don't have time. So they kind of need the education created that they can just print it out. And we need more research for sure that proves a definite connection between health and climate. And Alan can speak to that probably too. Alan's been doing so much work with heat and trying to get that out.
Yeah, thanks. I think that's a great question. I think the first step is for healthcare organizations to make their voice heard. I think it's very difficult for individual clinicians in the context of a one-to-one conversation with the patient to say, well, guess what? Your asthma is because there's poor air quality today, and you should really do something to change public policy. But I think it's much more. I think the first step is for organizations such as the public health associations, the medical societies, to take a stand, and a public stand also. Fortunately, all the national healthcare organizations, the AMA, the American Hospital Association, the organizations that represent internists and gynecologists and pediatricians and family physicians, the American Nurses Association, they all have very strong position papers on climate change and health. But unfortunately, most of the organizations in Delaware, except the Medical Society of Delaware, do not have positions and do not have programs or projects to help what Deanna's talking about, to help spread information to the public and to the healthcare community, and to take a position on whether it's wind or plastics, wind energy, plastics, electrification of the ambulance fleets in the state. So, but when they do that, when those organizations take a stand and speak out, it becomes easier I think, for the individual clinicians to also get involved and to raise their voices.
I 100% agree, Alan. So getting the caregivers, like I think my way, getting them engaged is so important for that, to make them stronger, to know that that's where they should direct their activities. Of course, you would think it would naturally happen top down in these organizations, but unfortunately, it's not happening loud enough or fast enough until more people say this is important to us.
Thank you.
To Elisa's question, I was just thinking too, when you mentioned the change in your menus to a more plant-based menu, I would imagine you'd get some pushback on that or some questions, and that might be definitely an opportunity for some, gentle education.
For sure. The hospital hired this amazing new VP of operations, and he comes from a sustainable background. And so he's driving that change. It
That's
needs
awesome.
to be backed, by nursing too, who are on the ground when those trays get delivered. But having somebody that knows the importance of it, and I also continue to present to nutrition, and that team they're amazing. They really run with being sustainable and how they can make a difference. So kudos to our nutrition team at the
Yeah,
hospital.
that's awesome. I'm sure there's more questions out there. Everybody loved your presentation, so thank you, Deanna. And I'm sure some of you out there must have some questions.
Well, can I just make mention one thing about what Deanna spoke about, and that is the sense of people feeling powerless. And I think one way of combating that on the hospital side, as Deanna mentioned, is to make it obvious that what the hospital does, what healthcare does, can have a positive or negative impact upon people's health, and also that it's very expensive, especially when you're doing the wrong things. If you're doing too much testing or making people drive for an appointment that they could really just as easily have over a Zoom link. But to make that connection between better health and less expensive healthcare by doing things which are obviously good for the environment, but also just a reminder, a heart healthy and a planet healthy diet are the same by and large. So when any of us think about what we can do, if we think about it not just as saving the planet, but improving the health of ourselves and our families, that becomes, I think it becomes easier to do. Even if you don't think that I'm really going to save the planet, at least you and your family can have a healthier, more productive, satisfying life.
Mm-hmm.
And there are folks locally, I know this is Plastics Free Delaware, but there are two physicians in particular in the county, David Donahue and Debbie Zarek, who practice together in North Wilmington, who are lifestyle physicians. That's a kind of a new terminology. And what they do, they give talks on this, and they do this in their practice. They talk about uh, uh, how to live in a way which is not only healthier for you but healthier for the planet.
Yeah, Dr. Donahue has been a keynote speaker at our youth summit twice now, and they're my doctors as well. So I love their approach to their practice. It's awesome. And Dr. Donahue talked to our youth summit specifically about, well, everything you just covered, Alan, but the connection between plant-based eating and environmental impacts. And Sophia asked a question in the chat, Deanna, about how you navigate relating to the same question about a primarily plant-based menu. How do you navigate the pushback of climate deniers? Because I guess she had trouble in a previous hospital she worked at, with some people get really nasty about it.
I think they try to make the plant-based option sound amazing. So the description of it is one of the ways. And I think they haven't gone to it yet, but they're slowly increasing with the goal of almost going all plant-based with the opt-in to meat. But they're working hard on that. and to make plant-based options so much more desirable. Actually, when I was in the trailer today pulling trash out, it's the entrance for our employees, and one of the chefs came in and he was showing me pictures of the food that they've been preparing, and it looks amazing, the plant-based options, like so gourmet. And that was for like a banquet function, but that is still, it's still expanding into the patients as well. And let's see, so can I answer some questions because I can see the chat now. So Christy, you absolutely can put this recording up, and whatever we can do to play a role in sustainability with Newcastle County, we want to participate because I think you need health communities in your sustainability plan. And we are not using metal utensils in the cafeteria, but they're using a plant-based plastic to my knowledge. And can the hospital compost? I've called up and tried to get the hospital to compost, but through DENREC, and I have not found a place that would let the hospital. There's no commercial sites in Delaware right now. So if anybody develops one, we would like to compost. And we started a garden out back for our residents as a stress reliever for their residency program. And this was our first year. And so I put them in contact in the kitchen with Plastic Free Delaware about starting a compost, but through Plastic Free Delaware. And I don't think it happened, but I think they had a lot on their plates with just starting the garden next year.
Yeah, we're happy to talk about that. And just, I know that, I don't know if you looked into through Keep Delaware Beautiful and DSWA, they have a program where they would give you a biodigester, which I have some reservations about because it sends the end result into our sewer systems. And there are biodigesters, though, that actually where you don't do that, where it just produces soil, which you could then put back out into the garden or the landscaping or whatever. But that, I know that was having those biodigesters as an option was one of DSWA's goals to put in some of the larger institutions like schools and hospitals, because they're the largest producers of food waste.
Yeah, so I did sign up and got that information and then shared it with our nutrition team. I think they were really worried about the durability of how much scraps that they had, but I did pass the information on. With doing all these different activities. Like I start something and then like try to throw the baton to someone else and like go on to catch the next ball. Right. So you ever want to follow up on that, but they do have some information. Trey, do you have a question? Is your hand up?
Yes, I was wondering, I'm not sure about the hospital itself, but I know that some of the adjoining offices that are affiliated with the hospital, whether it be gowns or other things that come wrapped in the single-use plastics. And I've asked them about it, and they're like, well, that's the way they come. And I didn't know if you've addressed that at all, Deanna. And also, this is an amazing talk. Thank you.
Oh, thanks. I'm trying for the next step to get the hospital to switch back to reusable infection gowns, at least for the rooms, not necessarily the operating rooms, because that's a whole different ball game. So they're thinking about it. I don't know why the plastic gowns are individually wrapped. Again, it's some of that craziness of preventing infection that people think is preventing infection, but it's probably not. But once you get started in this process, it's hard to go backwards. So we are looking into going to reusable gowns.
Oh, thank you.
And we don't recycle gloves, but looking at a program with teaching staff how to correctly use gloves, and that if you're just listening to lungs on a patient, you don't need to put gloves on. And then 6% of all gloves are wasted. So when you go to take a glove from a box, to hold your hand on the other gloves when you pull one out. And I try to also educate our techs not to go back and refill the boxes so they're overflowing instead of changing the boxes out, because that just, you pull one and 25 come out, they hit the ground and they all go in the trash. Any other questions?
I don't see any more in the chat. Are there any more out there? Anyone itching to raise their hand?
I thank everybody for coming today, and you want me to share information and give other talks. I'm happy to do whatever I can to further advancing making health a heart of climate action for that broader goal of, you know, for overflowing to other sectors to really get the emission reductions that we need.
Well, as someone said earlier, you're like definitely pulling your weight as far as an individual doing action. You're more than pulling your weight, and your children should definitely be proud of you for all you've done and your promise made to them. So we thank you for all you've done, and it's really, I think, a model and a huge impact. So thank you.
Oh, thank you. Thank you to all your work that you do, Dee. You do such comparable, you do even more than me.
So we will be in touch. I'm sure we
Yeah.
will continue to partner moving forward. So thank you so much for being with us today. Thanks everybody. And we'll send out the recording link and the recording link to the little short that Deanna mentioned. So
Okay. Thank you.
all right. Have a great afternoon, everyone, and happy
Thanks so
Thanksgiving.
much.
Thanks.
Thank you.